Have you ever felt an odd, tingling sensation in your legs, or noticed they become unusually tired, even with gentle walks around the block? It might be easy to dismiss these strange feelings as part of getting older, but there's a hidden culprit that often goes unnoticed: high cholesterol. In this video, we're exploring the surprising ways this silent condition can show up in your legs. Symptoms that many seniors overlook until it's too late. If you stick around until the very end, you'll discover how to recognize these warning signs before they escalate, plus learn the simple steps you can take to keep your legs strong and healthy. Get ready for an eye-opening journey that might just change how you view those everyday aches, pains, and twinges in your legs. Strange symptoms in the legs caused by high cholesterol often surprise even the most health-conscious seniors. Unlike some ailments, high cholesterol doesn't always shout its presence with obvious discomfort, like a sore throat or a pounding headache. Instead, it lurks quietly in your arteries, slowly narrowing and hardening them over time. When that happens in the legs, the symptoms can be easy to shrug off as part of normal aging. Yet these subtle changes hold crucial clues that can guide you toward a healthier lifestyle. One of the earliest and most overlooked indicators is a feeling of heaviness or fatigue in your calf muscles. Perhaps you start out on a short walk, only to discover your legs cramp up sooner than expected. You pause, the discomfort eases, and you continue until it returns again. This isn't necessarily normal aging. It could be a silent alarm called intermittent claudication, which occurs when your leg muscles don't receive enough oxygen-rich blood due to cholesterol buildup in the arteries. Although some seniors push through this, hoping it's just a passing ache, it's a symptom worth noting. After all, consistent muscle fatigue that improves with rest is a red flag for possible arterial blockages. High cholesterol in the legs can also reveal itself through a change in skin color or texture. Have you ever noticed parts of your leg appearing slightly paler than usual, maybe with a faint, almost bluish tint? This is more than a cosmetic issue. Reduced blood flow can deprive the skin of essential nutrients, leading to a dull or unusual hue. Sometimes the skin becomes thin, shiny, or even scaly as circulation worsens. These odd transformations might not sound dramatic, but collectively, they point to the possibility that your arteries are struggling to move blood efficiently. Another peculiar warning sign is the loss of hair on your lower legs and feet. This sort of hair thinning can occur for many reasons, so it's easy to ignore if you're unaware of what it might signify. However, when combined with other symptoms like leg cramping, skin discoloration, and cold feet, significant hair loss in the lower extremities can be a direct symptom of restricted blood flow. Your body essentially diverts resources away from the areas with poor circulation, and hair can stop growing where the blood supply is limited. While hair itself may not seem like a big deal, any change in your body's natural patterns deserves a closer look. Crucially, your feet can be the site of more alarming signs, particularly sores or wounds that heal slowly or not at all. Think about a blister or a small cut on your foot that lingers for weeks, even though you've been careful with bandages and ointments. High cholesterol may be at the root of the problem by constricting blood flow and depriving the tissue of the oxygen and nutrients needed for proper healing. In some cases, the surrounding skin can feel unnaturally cool or appear brittle. These persistent foot sores shouldn't be brushed aside as minor nuisances. They can be the body's urgent message that something deeper is wrong. Then there's the matter of leg numbness or tingling, a sensation many seniors link to neuropathy or just getting older. It might feel like pins and needles, or a vague sense that your legs fall asleep more often than they used to. When arteries are narrowed by cholesterol, reducing blood flow to nerves, this prickly or numb feeling can intensify. Some people even report an uncomfortable restlessness in their legs, especially at night. While restlessness and tingling can have different causes, it's essential to be aware that high cholesterol is one possible culprit. If these symptoms sound strangely familiar, don't panic, but do take them seriously. High cholesterol that affects the legs is often an extension of a broader cardiovascular issue. Narrowed arteries in one region of the body may indicate you're at risk for blockages elsewhere, including those that supply the heart and brain. Early detection is key. Catching these leg symptoms can help you and your doctor address your overall cholesterol levels before more dire consequences, such as a heart attack or stroke, occur. So how do you fight back if you suspect high cholesterol is messing with your legs? A great place to start is by visiting a healthcare professional who can order tests like the ankle brachial index, ABI. This simple, non-invasive test compares the blood pressure in your ankles to the blood pressure in your arms. If there's a significant difference, it may be a sign that cholesterol plaques are obstructing the circulation in your lower extremities. Ultrasound evaluations, or MRIs, can provide more detailed imaging if needed, helping your doctor pinpoint where the blockages might be. Once you have a clearer picture, it's time to take action. Typically, doctors will explore both lifestyle adjustments and medical treatments. Medications called statins often come up in these conversations because they help reduce the production of cholesterol in your liver. In some cases, other medications can help maintain healthy circulation or manage symptoms like leg pain. These treatments, combined with thorough monitoring of your condition, can make a remarkable difference in your long-term health outlook. But perhaps the most important piece of this puzzle is your day-to-day routine. Even if you're over 60, it's never too late to adopt habits that improve blood flow and bring down cholesterol levels. A balanced diet is a cornerstone of that effort. Focus on foods that are high in fiber and low in saturated and trans fats, like fresh fruits, vegetables, whole grains, and lean proteins such as fish or poultry. Oatmeal, beans, and nuts can be fantastic additions, helping to naturally lower LDL, bad cholesterol. Don't forget the vital role of physical activity. You don't have to train for a marathon to see benefits. Start with gentle, regular exercise tailored to your comfort and abilities, like daily walks or simple stretching routines. Each step helps your muscles use oxygen more efficiently and can even encourage new blood vessels to form around those narrower arteries, improving overall circulation. If you're already noticing leg cramps or fatigue, work with a healthcare professional or a fitness instructor specialized in senior wellness. They can help design a gradual exercise plan that challenges you without pushing beyond safe limits. Over time, these sessions can lead to surprising improvements in endurance and circulation. Beyond diet and exercise, remember to address other heart-related habits, like quitting smoking, if that's relevant to you. Smoking constricts blood vessels, making any cholesterol-related buildup even more dangerous. Similarly, consider keeping track of your blood pressure and blood sugar levels, because they're often interconnected with cholesterol issues. Maintaining a healthy body weight can also go a long way toward easing the burden on your legs and your heart. For many seniors, stress levels climb as they navigate life transitions, health concerns, or family changes. Chronic stress can affect cholesterol by triggering hormonal shifts that raise inflammation and promote plaque formation in the arteries. Therefore, finding mindful ways to manage stress, like engaging in a calming hobby, practicing gentle breathing exercises, or even enjoying quiet moments in nature, can be a powerful, though often overlooked weapon against artery-narrowing cholesterol buildup. Let's also acknowledge the mental toll that worrying symptoms can have. If your legs consistently send painful signals, or you worry about a wound that won't heal, it's natural to feel uneasy. Rather than ignoring these concerns, lean on support systems. Talk to family, friends, or healthcare providers who understand what you're going through. Sometimes the greatest obstacle is fear of what we might learn if we seek help. But getting answers and taking action can liberate you from that fear, offering the chance for better health outcomes and renewed peace of mind. In fact, staying informed and proactive puts you firmly in charge of your well-being. Observe your legs. Check for changes in color, temperature, or hair growth. If you find a sore that's slow to heal, don't hesitate to ask your doctor about it. When you walk and feel unusual cramps or tingling, record the details, the intensity of pain, how long it lasts, what eases it, so you have accurate information to share. These seemingly small steps add up, empowering you to detect warning signs early, discuss them with a professional, and make guided choices on how best to maintain healthy blood flow. Sometimes, the difference between thriving and struggling hinges on early recognition of an issue. High cholesterol in the legs might seem confusing at first, but once you understand its strange symptoms, such as stubborn wounds, cold feet, hair loss, or recurring leg pains, you'll be better equipped to recognize them in your own life. Knowledge is a gift, and in this instance, it may even be life-saving. By learning to connect these subtle dots, you gain the power to steer your health in a more positive direction. Try not to underestimate the cumulative effect of small, consistent changes. A short daily walk, a little extra fiber at each meal, and a conscious effort to cut back on sugary or heavily processed foods can gradually reduce cholesterol levels. Meanwhile, periodic checkups with your doctor will help you stay on top of any new developments. When you combine medical guidance with everyday healthy choices, the results can be astonishing. Above all else, remember that improved circulation doesn't just help your legs, it invigorates your entire body. Strong, open arteries support more efficient oxygen delivery, fueling every organ with what it needs to work at its best. This ripple effect can lead to better energy, clearer thinking, and a stronger sense of vitality, even into your 60s, 70s, and beyond. High cholesterol no longer has to be a quiet intruder, gradually limiting your life. Once you identify its disguised signs, you can tackle it head-on and enjoy a healthier future filled with meaningful activities and independence. So there you have it. High cholesterol isn't just about numbers on a lab report. It can reveal its presence through strange symptoms in your legs. Now is the time to take charge of your health. If you found these insights helpful, be sure to subscribe for more tips on living wisely and well in your golden years. Like this video and share your thoughts in the comments below. And don't forget to turn on notifications so you never miss an update. Keep exploring and stay healthy.